How often must the dressing be changed? Dressing changes should be completed every 7 days. A central line dressing may need to be changed sooner than 7 days if the dressing is falling off and cannot be reinforced, or if it has become contaminated or dirty. Your health insurance may cover weekly visits from a nurse to your home for dressing changes. Also, if the dressing is due to be changed on a day you are being seen in clinic, nursing staff can assist you. However, it is important that you are able to perform a dressing change on your own in case of a soiled dressing and should never wait longer than 7 days. Central line dressing changes are a sterile procedure and must be completed carefully in order to prevent contamination of the central line. A second person is almost always needed, especially when being completed on a young child, to help maintain sterility. Steps to changing a central line dressing. Always begin by sanitizing your workspace surface to make sure the space is as clean as possible. It is important to use disinfecting wipes as directed on the product container. Be sure to use enough wipes so that the surface you are cleaning remains wet for the specific length of time to kill germs effectively. This kit includes sterile gloves, masks, and new dressing supplies. There will be extra supplies in the kit that are not needed and may be set aside. If your child is unable to understand the importance of staying still during this process, it is necessary to have a second helper to safely complete the dressing change. You and your helper should wash hands at this time and put on a pair of clean or regular gloves and a mask. Prepare your sterile field by opening your dressing kit while making sure not to touch any of the inside supplies. If your child will cooperate, place a mask over their nose and mouth. If they cannot wear a mask, keep your child facing away from the line. On your clean surface, open the package of sterile gloves, being careful to only touch the outer inch of the paper the gloves are folded on. Do not reach over the sterile field. Now your sterile field is ready for you. Before putting on your sterile gloves, make sure your child is well positioned and the old dressing has been removed. Remember, once your sterile gloves are on, you can only touch the things inside of your sterile field. Removing old dressing. If you are performing the dressing change alone, at this time you should remove the old dressing. If you have a second helper, they can remove the old dressing as you prepare your sterile field. Start at the bottom of the dressing and work your way up towards the insertion site, being careful not to dislodge the line. Once the dressing is off, remove your gloves, wash your hands, and put on your sterile gloves. Pick up the glove of your dominant hand with your non-dominant hand using the cuff of the glove. Slide the glove onto your dominant hand. Once gloved, be careful not to touch anything except the inside of the sterile packaging or the other sterile glove. Next, with your sterile gloved hand, slide your fingers underneath the cuff of the other glove. Pick up the glove and slide it onto your other hand. Adjust the gloves as needed, being careful not to touch your skin or any other objects. Now that you are sterile, you can touch the items inside your sterile field and only those items. Your dressing change kit will include a ChloraPrep wand, BioPatch, and Tegaderm. Iodine and alcohol will also be included, but only needed if your child is allergic to chlorhexidine. Assessing and cleaning the central line site. Assess the central line site as you clean. If you notice any redness, drainage, bleeding, or oozing at the central line site, call the clinic. Ensure that the sutures are present and properly securing the line to the skin. Squeeze the ChloraPrep swab in your dressing kit and clean starting at the insertion site, working your way outward in a circular motion. Once you clean outwards from the insertion site, do not go back in towards the center, as this could introduce bacteria to the site. Allow the site to dry completely. The germs are killed as the ChloraPrep dries. Do not wave over the site to speed up the drying process. If there is any debris on skin from adhesives, use the alcohol swab in your kit to cleanse. If your kit contains a sticky wipe, you may apply this on the skin around the central line to help ensure the new dressing is well adhered. Putting on the new dressing. Place the BioPatch around the central line at the insertion site with the correct side facing upward. Make sure the ends of the patch meet. This helps bacteria from growing at the site. Have your second person position the line away from diaper or ostomy areas when possible. Ensure the BioPatch and insertion site are clearly visible in the window of the dressing, and place the new dressing over the cleaned site. Gently rub your fingers along the borders to ensure a good seal and that the central line is well covered. Once the site is covered, you no longer have to worry about being sterile. Label the dressing with the date it was changed to help you keep track of when the next dressing change is due. Your central line dressing change is now complete.